Ibuprofen Solution, Reconstituted, Recon Soln, is a medication used to help relieve mild to moderate pain and reduce fever. It can also be used with an opioid to relieve moderate to severe pain. This medication is known as a nonsteroidal anti-inflammatory drug, NSAID, and it works by blocking the body's production of certain natural substances that cause inflammation. This helps to decrease swelling, pain, or fever. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before you start using ibuprofen, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for guidance. When using this medication at home, it's important to carefully follow the preparation and usage instructions provided by the manufacturer or your healthcare professional. If you have any doubts about using this medication properly, consult your doctor or pharmacist. Before using the solution, always check it visually for particles or discoloration. If you notice either of these, do not use the liquid. Ibuprofen solution is usually given by injection into a vein as directed by your doctor. For adults, it is usually given over at least 30 minutes, while for children it is given over at least 10 minutes. When used to relieve pain, it is usually given every 6 hours as needed. When used to reduce fever, it may be given every 4 to 6 hours as needed. For infants 3 to 6 months of age, it should be given as a single dose. Make sure to store and discard needles and medical supplies safely, and consult your pharmacist for more details. While using this medication, it's important to drink plenty of fluids unless your doctor advises otherwise. The dosage of ibuprofen solution is based on your medical condition, age, and response to treatment. In children, the dosage is also based on weight. To minimize the risk of stomach bleeding and other side effects, use this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or use this drug more often or for longer than prescribed. If you are using this drug as needed, remember that it works best if used as soon as the first signs of pain occur. If you wait until the pain has worsened, the medicine may not work as well. If your pain or fever lasts or gets worse, be sure to inform your doctor. If you experience nausea, dizziness, gas, headache, or upset stomach, contact your doctor or pharmacist. This medication may cause side effects such as changes in hearing, vision, or mood, as well as symptoms of heart failure or liver damage. It may also raise your blood pressure, so be sure to monitor it regularly. If you notice any serious side effects or signs of an allergic reaction, seek medical help immediately. Remember to consult your doctor or pharmacist if you experience any effects not mentioned here. Ibuprofen solution, Reconstituted, Recon Soln, is a type of nonsteroidal anti-inflammatory drug that may rarely increase the risk for a heart attack or stroke. This risk is more likely if you use it for a long time and may be greater in older adults or if you have heart disease, high blood pressure, or diabetes. It is important not to use this drug right before or after heart bypass surgery. This medication may also rarely cause serious bleeding from the stomach or intestines, which can occur without warning symptoms. Older adults may be at higher risk for this effect. If you notice any stomach/abdominal pain that doesn't go away, black/tarry stools, or vomit that looks like coffee grounds, it is important to seek medical help right away. Other serious side effects to watch for include chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, and sudden vision changes. Before using ibuprofen solution, Reconstituted, it's important to discuss any allergies you may have with your doctor or pharmacist. Additionally, be sure to inform your healthcare provider of your medical history, particularly if you have any liver disease, stomach/intestine/esophagus problems, heart disease, high blood pressure, stroke, blood disorders, asthma, or growths in the nose. It's essential to stay hydrated while taking ibuprofen solution, especially if you are an older adult, have heart failure or kidney disease, or are taking certain medications. This can help prevent kidney problems that may occur with NSAID medications. Be cautious when using alcohol or marijuana, as they can enhance the dizziness caused by this medication. It's important to limit alcohol consumption and stop smoking to reduce the risk of stomach bleeding. If you are planning to have surgery, inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. When taking this medication, be mindful of sun exposure, as it can make you more sensitive to the sun. Use sunscreen and protective clothing when outdoors to prevent sunburn or skin irritation. It's also crucial to have a discussion with your doctor if you are a woman of childbearing age, are pregnant, or plan to breastfeed while using ibuprofen solution. This medication may have potential risks for unborn babies and nursing infants, so it's important to seek medical advice in these situations. It's important to be aware of potential drug interactions with ibuprofen solution, Reconstituted. Talk to your doctor about all the products you use, including prescription and non-prescription drugs, as well as herbal products. This medication may interact with other drugs such as ACE inhibitors, corticosteroids, and blood thinners, which could increase the risk of bleeding. It's also important to check labels carefully for other pain/fever drugs, as using these in combination with ibuprofen could increase the risk of side effects. If you are taking low-dose aspirin for heart attack or stroke prevention, consult your doctor before taking ibuprofen. Ibuprofen may decrease aspirin's ability to prevent heart attack/stroke, so it's important to discuss alternative medications with your doctor. If you must use ibuprofen, talk to your doctor about the timing and dosage of aspirin to avoid potential interactions. Always consult your doctor before making any changes to your medication routine. If someone takes too much ibuprofen solution and experiences severe symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, vomiting that looks like coffee grounds, and extreme drowsiness or dizziness. It is important not to share this medication with others. Your doctor may also request lab and/or medical tests such as complete blood count, liver/kidney function, and blood pressure while you are using this medication. It is important to keep all medical and lab appointments. This medication has been prescribed for your current condition only, so do not use it later for another condition unless told to do so by your doctor. In those cases, a different medication may be necessary. Always follow your doctor's instructions. When it comes to ibuprofen solution, Reconstituted, it is commonly used for relieving pain and reducing fever. This medication is usually taken by mouth and can be taken with or without food. The dosage is based on your medical condition and response to treatment. It is important to take this medication as directed by your doctor. Ibuprofen solution, Reconstituted, is best taken with a full glass of water as it may help to lessen stomach upset. It's important to take this medication at the same time every day to help you remember. If you have any concerns about the timing or dosage of this medication, be sure to consult your healthcare provider. It's important to store ibuprofen solution, Reconstituted, Recon Soln, at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. When you no longer need the medication or it has expired, it's important to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.